Hello, we are pleased to have Dr. Neha Rastogi Panda with us today. I am Anshita Pandey on behalf of Fever Clinic who welcome you all to video podcast for World Tuberculosis Day. Dr. Neha Rastogi is currently working as consultant infectious diseases at FMRI Gurgaon and core member of Antimicrobial Stewardship Committee and Infection Control Committee and also core member of Fortis Central Infection Prevention and Control Committee, and also she is the member board in mucormycosis at Fortis Hospital, Gurgaon. Dr. Neha has completed DM, infectious diseases and MD and senior residency also from AIIMS, New Delhi. She has a rich and varied experience of over 12 years and is a specialized medical professional in management of infectious diseases of both national and international importance, COVID-19 with its sequelae, tuberculosis, drug-resistant, TB of lung and other body sites, HIV infection and tropical infections, malaria, dengue, leptospirosis, and scrub typhus. Dr. Neha is also member of esteemed international and national societies. What actually is TB, tuberculosis, and how does it spread?
TB is tuberculosis. It's actually a disease complex caused by bacteria called as the Mycobacterium tuberculosis. And its main spread is basically through the airborne. So it's basically a droplet nuclei, the small nuclei which get suspended in the air. When you laugh, when you talk, when you sneeze, or when you cough, it spreads to another.
Who is at risk of TB disease, ma'am? Who is at risk of TB disease, ma'am?
So I will define it as the broad spectrum if I say. So there are a couple of people who are at the risk. So actually, practically everyone is at the risk of tuberculosis in the post-COVID era. But if I have to highlight the people who have a weak immune system, so for example, the elderly people or too younger people, the people who have HIV, the people who are cancer patients, those who are on active chemotherapy, diabetes, kidney patients who are on dialysis. Also, the people who are living in the very close contact with the positive active TB cases, they are also at the risk of developing TB. And children who have less than 5 years, whose one of the parent is having an active TB.
Just what are the symptoms of TB?
So TB symptoms are actually defined on the base of that what organ of the body it is getting affected. So most commonly we see the TB of lung. So TB of lung has the symptoms of either in the form of fever, cough, cough with the blood, cough with some kind of sputum. Then along with that, we have loss of weight, loss of appetite, extreme weakness from the patient perspective. And if we have TB of other sites, for example, brain TB, you can have headache, you can have fits, you can have stomach TB or abdominal TB where you can have the loss of appetite and weight loss. You can have TB of bone and spine where you can have a backache. So TB symptoms depend upon which site of the organ it is getting involved with.
What is actually active TB?
So basically, we have two types of TB, latent and active. So active means that you are already infected by a TB bacilli and you have disease symptoms.
What are the tests for TB infection which a patient should go for?
So if you have an active TB, means if you have a TB symptoms already, so then the tests can be of varied interest. You can have the microscopic based detection where you can just see a TB bacilli with your own eye with the help of microscope from the sample. Also, you can have the various, nowadays we have very good new platforms of test in our country which can detect even minute DNA of that bacteria into a particular sample. So sample depends upon which site of area, which site of the body is involved. And then you can either see a bacteria, you can grow a bacteria in the lab with the help of cultures, and you can see the microbial DNA with the help of new molecular techniques.
What are the effects of medicines to treat this TB infection?
So, we have a lot of TB drugs which we give to the patients. So if I tell you about the common effects of the first line TB drugs which are being used, that is, there are 4 drugs combination. So most commonly people get initially some flu-like symptoms like some chills, some kind of rashes or acne as a part of a drug reaction. One of the medicine in the TB goes through urine and other body sites. So it causes orange color urine and orange color secretions like sweating in the orange color or a urine of orange color. So that's not something to be afraid of. That's a part of the effect of the TB medicines. Along with it, you can have certain weakness. Sometimes you can have vomiting like sensation when you have these medicines.
Like if I was exposed to someone with TB disease, then can I give TB to others? I mean, is it communicable disease?
So yes, if you have a TB of a lung, which is in its active stage, means if X person whom you are sitting with and have an active lung TB and he's coughing out, he's giving a lot of sputum production. If you are not wearing mask, you are in a very close contact in a poor ventilated room. Yes, the chances of you getting a TB from that person will comes to almost 10 to 15%. And then the same scenario where you land up with some other person, you are also equally infectious to that person.
How is TB disease treated? How to know the TB is improving?
So, TB disease is treated with the help of anti-tubercular medicines, which are commonly called as the ATT, anti-tubercular therapy. So that consists of the good amount of combination of 4 to 5 drugs. So how you say that the TB is improving? Again, I'll say it's depend upon which site of TB is involved. So it is first will help you in that what symptoms you started with. So for example, the person had a fever and a cough. So after taking a TB medicines, fever will go and cough will go. So clinically, you should be improving. And then the second part is the radiological or imaging wise. So if you have a pneumonia in the lung and with the cough and fever, so first your fever and cough will go. And then X-ray wise, your pneumonia will also go. So clinically and radiologically, we assess the improvement in terms and also the microbiological. So if you have a TB bacteria detected first time in the lab, at the end of a successful therapy, the bacteria will not be there in the next time.
Okay. Ma'am, why is it important to take TB medicines regularly for the entire duration of the prescribed course? I mean, it's like we cannot miss a single medicine.
So thanks for bringing this question out, Anshita. So through this platform, I also want to highlight that even though we have mentioned about few side effects of the medicines, it becomes very important for the person to take the entire course, because you need to not to have a resistance of the existing TB drugs, because if you miss out on the doses, you will bound to happen a resistance for those TB drugs. Second, recurrence. So if you miss out the drug dose of the TB for a good amount of time in the first episode, there are high chances that you land up in the TB of the other side or probably many sites the second time. So both to prevent resistance and recurrence, it is very important to not to miss a single dose in the TB course.
Okay, ma'am. Ma'am, next question is, how long does spine TB take to heal, and how can we recover from spinal TB?
So like other forms of TB, spinal TB is actually a very difficult to diagnose, but spinal TB gets also treated by the same combination of the anti-tubercular therapy. And it takes a little longer as compared to the lung TB, I would say. It usually takes a year, almost 9 to 12 months, we say usually, to complete the course for the spinal TB.
The spine TB take to heal, and how can we recover from spinal TB?
So like other forms of TB, spinal TB is actually a very difficult to diagnose, but spinal TB gets also treated by the same combination of the anti-tubercular therapy. And it takes a little longer as compared to the lung TB, I would say. It usually takes a year, almost 9 to 12 months, we say usually, to complete the course for the spinal TB.
So the last but not the least question is, ma'am, please can you give us like a brief idea about what is BCG vaccine?
Sure. So BCG vaccine is basically a bacillus calmette urine vaccine. That's one of the age-old vaccines we use for TB prevention in our kids, neonates. So if they are given to your small kids and neonates, it almost protect up to 75 to 80% against the severe forms of TB. So one thing I would like to clear is that it does not say that you will never get TB from the others, but it will prevent the severity of that TB up to 75 to 80%.
Okay, ma'am. Thank you for such a valuable time and such knowledgeable answers. This FAQ round is like we'll give it an end. And thank you, doctor, for a valuable round of FAQ with Fever Clinic. We request our followers to contact us on number displayed on screen for queries. And thank you so much, ma'am, for your precious time.
Thank you, Anshita, for providing us a platform to create the awareness regarding the TB. And thank you all viewers to be a part of this. Thank you.
Thank you, ma'am.